Hello, I'm David Oliver, and this is video number 12 in our series about my cancer journey. This one we're calling Cancer, My Exit Strategy. I have nasopharyngeal carcinoma, metastasized to the bone. It is stage 4, it's not curable. I've gone through 6 chemotherapy treatments, and now we're having PET scans every 3 months. And we know it will come back, we just don't know when. But this waiting has been very tedious.
Tedious indeed, but the advantage of it is that it has given us time to have a lot of really difficult conversations. And in the last couple of months especially, David and I have been going back and forth talking about trying to really make some decisions. And I've asked him to kind of tell me, okay, so how is it that you want to die, David?
Well, I want to die well.
And what does that mean? That tells me nothing.
Well, I've developed an acronym for it. It spells HOPE, so it's pretty easy to remember. The H stands for home. I want to die at home. The O stands for others. I want to be surrounded by others, family and friends, and as far as I'm concerned, anybody can walk in. P is for pain. Actually, pain management. I do not want to suffer. And in this day and age, I don't think you should have to suffer with cancer. And the E stands for excitement. I still want to be excited about living. I hope people want to come visit, and they will come into a house full of, fun and not depression.
Well, certainly those guidelines give me a lot to ponder as this process goes on, and I have to make decisions in order to make those things happen for you. Together with a hospice program, then we will make sure that we keep you at home, and that means that I don't panic and call 911 and have people come out here when times get tough. But instead I call a hospice, and we do everything we can to make you comfortable right here at home, and that may mean bringing a hospital bed in and lots of other things.
I'd like to have that bed on rollers so we can roll it over to the window and roll it to the dining room table. What do you think?
Well, I think it definitely is something that we like to keep out in the public, because you're not one to go hide in the bedroom over there.
That's right, I'm counting on you.
And the others means that we have to make sure we invite people, and that they continue to stay connected with you, and they're not fearful that they're intruding in your privacy, and that they're not going to be welcome, that our home is going to be an open place with lots of traffic and lots of people in.
I think it's important that we make them comfortable.
Absolutely.
Coming in.
And then pain, that means that there are a lot of choices that may have to be made, and pain management and the lack of pain will be our utmost goal. So if the time comes when we have to choose maybe for you to be, between you to be pain-free or to be sedated or a little bit groggy, that we'll choose the pain-free rather than being totally cognitive present at times.
I'm willing to be unconscious so long as I have no pain.
And then excitement is up to everybody who comes in. So that's going to be our challenge to everybody who comes in, to bring lots of fun and joy into our lives during what will be a trying situation. And I've never really known the Olivers to not be excited.
Debbie, just sitting next to you is exciting, It just sweeps me off my feet.
Well, I'm quite sure that your exit will not be a traditional one, for sure.
That's right. Well, this will come to pass, and I'm glad we've had this time to think about it and share it with you. So good luck, and we'll see what this next PET scan shows, and we'll be ready.
And keep your jokes and fun, because we're going to need it.
That's right.
Go Tigers!
Go Tigers!